Hi, I'm Dr. Chikondi Akobe, and I'm going to take you through my leadership project, Cervical Cancer Awareness, through community radio and social media by women leaders. I'm an obstetrician gynecologist, and I work with Baylor Foundation Malawi, and I'm also the principal investigator of a grant we received to roll out a cervical cancer comprehensive program. So, why cervical cancer, you might ask? Cervical cancer kills 5 in 100 women. And the amazing thing about cervical cancer is it is curable. It is curable if it is discovered early. And WHO has a target that 90% of women in your population, our populations, should be vaccinated against cervical cancer. 70% of them should be screened, and 90% should receive treatment, meaning that this cancer is something that doesn't have to kill as many women. So why don't women screen? Is because they are afraid of what they hear from their friends when they go to get screened. They're afraid of a speculum and they say it's too painful. We cannot get it. We would rather wait for the symptoms. So, what most of these women don't even know is that currently WHO has rolled out a gold standard for screening, which is HPV DNA. It's the same as taking a pen, something smaller than it, and inserting it yourself, meaning that women can self-test and it doesn't even have to be painful. So, my leadership project built off of the cervical cancer program to target message with a focus on vaccination for girls under 18 and screening for women. Our goal was to reach women that are in rural and urban centers with a message through means that they listen to. So that's the community radio and the social media. Our target reach was 10,000 women. So we did plan to do this for the year. However, because of project delays in itself, we ended up starting with a pilot community in our area of Lilongwe, Malawi, and we had to use women gatekeepers for that community to reach the women. So instead of utilizing the radio or the social media, we started with going to train them, teaching them awareness about vaccination, teaching them about the HPV DNA way of screening in order to increase the numbers and the rates that we were getting. In total, we trained about 273 teachers. These are sexual and reproductive health teachers in schools for the girls, as well as women leaders like chiefs and traditional authorities. And so our outcomes were quite successful. We saw 10,000 girls vaccinated in a period of less than 6 months, and we screened more than 25% of our target. As said, the project is still ongoing for 3 years, but for my leadership project, it also continues considering that January is an awareness month for cervical cancer. So, what did I learn from it personally? I learned to strengthen my voice, I learned to expand my mindset, and I learned to leverage my power. As I have said, for the next steps, we are targeting that for the awareness month of January, we will take it to a national scale and now actually take it to social media and radio. So, using women that are on the national stage. So, I have had to talk to these women. I have had to get them to buy into this idea and then borrow their voice and use that to amplify this message. And that alone is something that has required the skills that I have learned from this fellowship program. Because before, I was very shy and I was somebody who stayed in my corner and did my job. But now is when I've learned that with that, we can actually reach out to more women and not just the women in Lilongwe or the women at the center where I work. So I will leave you with this. If you want to go fast, you go alone. And if you want to go far, you go together. I would like to acknowledge my executive director, Ms. Phoebe Nyasulu, and the project team, as well as the grant team and the Women Lift Health team for the ability to go through this fellowship. Thank you very much.